This is all the one wonderful stuff, not only to prep the needles, but to draw out the blood they'll use to see how all my counts are doing. And there's the patiently waiting wife. Patiently waiting kids. One has no clue. The other one, well, she's waving hi the hard way. And if you can tell, this is starting to get a little infected. Yeah, and red.
Any pain? Okay.
Yes.
Have you had any temperature?
I've been really cold lately.
Feeling chills or your body?
Yeah, feeling chills. And I've had mouth sores too.
Okay.
But that's probably from the Affiniter.
Okay.
So basically, he's got to break open all the iodine patches previously to do it, because it's kind of a pain to do in the middle of trying to draw the blood and clean. So he previously opens them. So that way when he is cleaning the ports, they actually go straight to my heart. Right, Dua? These go straight to my heart?
To the tip of their... yeah.
To the tip of the what?
Tip of the top of your heart.
To the tip of the top of my heart. It's the closest thing to my heart.
Ready?
Yeah, go for it. So this is all the iodine to clean the tips. How many the iodine patches do you normally have to use?
3 per tip.
Three per tip. And you're going to change out all this today?
Yep.
Okay, cool. The alcohol pad to take off the iodine. And hopefully, if all goes well, there won't be any blood clots, or it won't be clotted inside there, and you'll just be able to draw out the blood nice and smoothly. And he flushes it with saline solution at first. Right, saline?
Mm-hmm.
See, that's how much they use on me right there. That big old pile.
Flush.
Yep, now he's gonna flush it out. Yeah, nice and smooth. No bloodlet, and I warn for the squeamish. You might see blood, or not. A little bit.
I'm gonna raise your hand. There you go. It's coming.
Is it clotting?
No, it's coming.
I have my arm turned back, which kinks off the valve. Nice warm blood. Mmm. Nice and steamy. See, with having a port, he doesn't have to use those big old needles inside there to stick inside me. Big old needles. Not going in me. So this is a much easier way to do it. Much preferably. Blood seems to be not wanting to cooperate today.
It's coming. I just didn't want to pull too much or it hemolyze the blood.
It'll what?
Sometimes if you pull too fast
Uh-huh.
and it being sluggish, it might break the red cells.
Oh, okay.
And that may interfere with some labs, but I just, because it is coming out fine, I didn't want to pull it any faster.
Is that just bubbles or is that chunky stuff inside the blood?
These are bubbles right here.
Yeah, okay. I've seen it where people actually have, you can see their cholesterol come out, little fatty deposits. It's kind of gross. Right?
Yep.
Basically, I'm beside myself right now.
Heparin flush.
And heparin helps keep the blood thin so it doesn't clot up. And that's one side done, and that's probably all the blood he needs.
Yes.
So what he's going to do now is fill up the tubes, and each tube represents something different, right?
Yep. And can I get your date of birth?
9/30/76. The vacuum inside the tube pulls the blood straight in. So it's kind of nice. He doesn't have to do anything to it. So what do the different colored tubes mean? We have purple, we have teal.
The purple is used for doing your complete blood count because each tube uses a different machine uses each tube, and each tube has its own additives.
Uh-huh.
The lavender we use that to do your blood counts, and then the green are for chemistries, and this one can be used for chemistries, or like if you had a tumor marker or something like immunoassay, then they would use this one. This one you would be able to use, it separates everything, so you would get the serum.
Okay.
The green one, when you spin it, it'll leave just plasma.
Okay.
And so that's why we have different tubes. And
Nice.
this light one is for your coags.
And coags tells you how well the blood's.
Your clotting factor, how
Yeah.
fast you would take to clot and or how long, and that's what we use this for. And this has its own separate tubes because it would have to be a full tube. You can't have any less.
Nice.
Okay.
So that's it for now because he's gonna have to take this stuff to the lab first. Then he'll come back and change the dressing.
Or
What?
the other
Fluff the other side.
the other tip.
Oh, okay.
And if you think this is a long, boring process,
You're right.
watching it, you should sit on it.
You should what?
Sit. Sorry, I have a speech impairment. That sounds differently than SH. I'm just gonna be quiet.
So our hand model here is gearing up for the other side now. Now I've seen it before when you've cleaned it, like you've actually pulled out like a strand of some clotting material that was actually inside the tube right here. What was that? Do you know?
In here?
Uh-huh.
No. From cleaning or when I draw?
It was during the process. I can't remember at what point.
I don't recall. Should not be. If it is, then maybe it was just a clotted fibrin inside it.
That's what you called it, fibrin.
Fibrin.
Yep. What is that?
Fibrin is just what your body makes. It becomes what it builds a clot.
Okay.
So in your body, there's fibrinogen, which becomes, I believe, fibrin, and that's just how they connect to each other to make a clot. That's all.
And typically, what does it take about a half hour for the labs to do their thing, depending on how backed up they are?
Yeah, it depends. It really depends on time of the day, volume.
But they love me here, so it goes quicker. Or they love to get me out, one or two.
You're a VIP. You get a special chair.
There you go. Closest to the bathroom. And that's not blood on his hands, that's just more iodine. I'm not leaking.
With this one, because we already drew the blood, we're just going to check for blood return, which is beautiful.
Well, thank you. I think you're quite handsome yourself.
No comment.
So how long have you been doing this now?
About 5 months.
Fair enough. 5 months and nice little piece of hair.
It's like a plastic thing for the from the syringe.
Ah,
Okay,
all right.
be back.
Thank you very
And
much.
can you tell me why you leave these on there? What it's for?
Because these are sterile.
Uh-huh.
So if we were to take these off, if you need, like when you for treatment later, or let's say on your regular follow-up days, and the Dr. Flam or doctor wants to give you something, then we just have to start over and clean it.
Ah, okay.
So it's just
Easier.
a little bit easier and cuts down a little bit on time. That's all.
Fair enough. Cool. Thank you.
You're welcome.
To be continued.